recognized.
Thank you, Madam President. The world we're living in today is a very different one than we envisioned when we rang in the new year in the beginning of 2020, or even when we celebrated St. Patrick's Day in March. COVID has altered almost every aspect of our lives, from where we gather to celebrate or mourn, to how our children are educated, and far too many across the country have lost loved ones to this disease, or they're living with the health complications because of it. However, while we are rightly focusing much of our nation's energy on coronavirus, this is not the only health crisis we are battling. Unfortunately, across the nation, drug overdose deaths are rising among the coronavirus, negating much of the progress that we made over the last several years. A White House Office of Drug Control Policy analysis shows that 11.4% increase in fatalities for the first 4 months of 2020. My home state of West Virginia reported 923 overdose-related EMS calls in May, which is roughly a 50% jump from the May of 2019. Our neighboring state of Kentucky, and I'm sure a neighboring state of Ohio too, has estimated Kentucky has estimated a 25% increase in overdose deaths between January and March. Is COVID-19 directly causing these overdose deaths? No. Is the pandemic exacerbating our nation's addiction struggle? Absolutely. And it's not hard to see why. The past several months have been difficult for all of us. However, for someone in recovery, this disruption may cause them to have a hard time keeping their treatment regimens in place. The need for social distancing may make does make in-person recovery programs that are a lifeline for some almost impossible. Social distancing may also lead to more individuals using drugs alone, raising the risk of overdose death because there's no one there to help or intervene. Last week, I had the chance to talk with the CDC Director, Redfield, about where we are in our nation's battle against addiction. The preliminary CDC data recently released showed drug overdose deaths climbed to a record high last year. How the addiction crisis continues to shift, also with overdose deaths rising in our other states, such as Alaska and some in the Dakotas. He also pointed out that deaths involving methamphetamine and cocaine have been steadily increasing, despite the fact that deaths caused largely by synthetic opioids has been decreasing, or actually pills have been decreasing. How issues like neonatal abstinence syndrome, where babies are born exposed to opioids, continues to spread. And we talked about the work that we've done here in Congress and what we continue to do. Over the years, as I mentioned, we've seen a decline in the deaths of prescription opioids. We've seen increases in access to treatment resources. Moreover, we've seen a recognition that as a country, we've got a real addiction crisis. However, these recent statistics and the evidence we are seeing related to substance abuse during our current pandemic shows us there is so much more work to do, and it has a sense of urgency to it for many of us. This sentiment was also shared with when I had the Director Carroll of the ONDCP. We met in Huntington just last Friday. Huntington's a town particularly hard hit by addiction. Director Carroll expressed his concern over the rising numbers of overdose deaths, and he acknowledged the public health threat that COVID presents, along with the essential mitigation measures implemented across the country to slow the spread. Together, we have created unprecedented obstacles for Americans to seek drug treatment. We discussed some of the response that the Trump administration has taken to the pandemic in our new reality. Trump administration has relaxed some of the rules related to the prescribing of medication-assisted treatment. That's been helpful. The increased role of telehealth in behavioral and mental health care, that's been helpful. The director updated me on ONDCP's work in working to address the specific impact that drug addiction is having on rural America. And just last month, the ONDCP and other federal agencies launched the Rural Community Toolbox, which is an online clearinghouse created with the express purpose of connecting rural leaders with funding, data, and information on how to combat drug addiction. We know resources in rural America are not as plentiful as they are in other areas of the country. We also discussed the administration's effort at the southern border to keep illegal drugs out of our communities. I am particularly interested in this area as I chair the Appropriations Committee for Homeland Security, the subcommittee on appropriations. Through this role, I was able to focus on the needs on the interdiction side so that drugs do not even physically get to West Virginia in the first place. I've been to our southern border, which is actually where most of the drugs are coming from that end up in my state. I've worked with Customs and Border Protection, the TSA, the Secret Service, and the Coast Guard to ensure they remain focused on this incredibly important aspect of our national problem. I'm also extremely proud of the work that HSI Division has done in Homeland Security. They've increased their presence in West Virginia in the number of officers, equipments, and partnerships such as with Marshall University to help supplement the work of our local law enforcement. HSI has expanded their presence on international mail facilities, something I've been a strong proponent of and many of us in this body have as well. Earlier this month, the Department of Homeland Security issued its 2019 seizures report to Congress. This report confirms that a majority of drugs continue to come in from our southwest border, including cocaine, fentanyl, heroin, marijuana, and methamphetamines. Challenges as a nation and individual fill out our reality today. I wish the drug addiction epidemic did not have to continue to be one of them. Sadly, as many families across our nation know oh too well, it continues to ruin many lives. Wishing it away is not going to work. We must continue to keep our eye on the ball, provide the resources necessary to resume the progress we've begun to see. My colleagues and I on both sides of the aisle have worked with the Senate Appropriations Committee to be committing much-needed resources. Chairman Blunt has shown his dedication to the cause both through the regular appropriations and through our stimulus bills. We continue to work to ensure that behavioral and mental health providers have the resources they need to continue to treat patients and keep their offices open. And I'm working with bipartisan colleagues on creative ways to address this crisis, whether by ensuring that doctors can offer non-opioid choices as they resume elective surgeries through my No Pain Act with Senator Jones, or by ensuring that those in treatment and recovery can use the technologies of today to connect virtually to peers and counselors through the Prescription Digital Therapeutics to Support Recovery Act that I have introduced with Senator Shaheen, or by arming families with the information and resources they need to help their loved ones stay in recovery during these trying times through the Family Support Services for Addiction Act that I've worked with Senator Gillibrand on. Fortunately, we continue to not be alone in this fight. Despite the other demands they are currently facing, community and local organizations continue to rise to the challenge. Just last week, Shatterproof, which is a national nonprofit organization dedicated to reversing the addiction crisis in America, launched the Addiction Treatment Locator Assessment and Standards Platform, also known as ATLAS. ATLAS is the first resource of its kind to help those seeking addiction treatments, helps them to find high-quality care and appropriate care. It was launched in 6 states. I'm happy to say West Virginia was one of them, with the hopes expanding it to many more. Our nation is facing unprecedented challenges. However, I remain confident we can meet all of them, including resuming the progress we had begun to make on our nation's addiction crisis. I'm dedicated to this, passionate about it, and look forward to continuing to work with my colleagues on creative solutions. Thank you, Madam President.